Well, hello everyone. Welcome back to PARC Retirement Living Speaker Series, Pathways Back Toward Calm. Today's our third session and with registered clinical counselor, Deborah Braun. So again, she'll be speaking today for 40 minutes and there'll be an opportunity for questions at the end of the talk. So if you have some questions that come up during the session, please make a note of them and we'll open up for questions at the end. And again, we'll be recording today, so that anyone that couldn't attend, we can replay it for residents or any family members or employees that would love to watch the series. So Deborah is here today speaking with us about to reroute anxiety. So please welcome back Deborah Braun.
Hello and welcome. I'm delighted to be back again. It's been a few weeks and I really enjoyed presenting a couple weeks ago. And actually listening to my colleague, Dr. Glow's presentation as well, which was great fun. So today, today I'm here, well, at my home versus yours, or your auditorium. It's just fascinating getting used to this new world right now, I must say. And I'm delighted to be here. And today we're talking about rerouting anxiety. Last time I chatted with you, I explained about the whole pathway system of the brain and how habitual we are. And because anxiety plays such havoc with us and our quality of life, we often consider it problematic. But actually, we can take some steps to prevent future discomforts when we pay attention to anxiety. And today I'm going to give you some helpful facts and some strategies so you can reroute it or give it a bit of a detour so it works more for you versus against you. So I'm just wondering about how you might be feeling, and I'm just gonna, there we go. I'm wondering if maybe you're feeling curious. The fact that you're participating today and dialed in really lets me know that you're likely to be a little bit curious about what this workshop might be about. And I welcome that. Actually, curiosity really helps energize your system, so you pay attention, you take in more, so that's great. I'm hoping that you're feeling somewhat hopeful. Sorry, a little pun, but just hoping that you might be wondering, hey, maybe this could really help me out here because it's been a bit of a challenging time, to say the least. So hope that that's what you're feeling. And perhaps some of you are even feeling skeptical, wondering, hey, is this actually going to create the results I want? Or what is she really going to talk about? Is this going to make a difference? Or maybe hesitant to invest, hesitant, wondering, you've listened to other things before, participated in other things, and maybe not gotten what you want. So you're welcome to have that. Maybe some of you are frustrated because you're being dragged here, or you're not wanting to go through your own fruition. Anyway, so however you're feeling, you're welcome. And I hope most of all that you're feeling willing and courageous. Because last time I spoke, I shared quite a bit of information and a number of tips, but I didn't really have you participate in many things. Whereas this time I'm going to hope that you're going to participate. So that's going to take a little willingness and courage on your part. And I can't guarantee anything, but by the end, I hope you feel energized, better equipped, maybe even empowered to reroute anxiety. So I'm just wondering, oops, my son's, there we go. So I'm just wondering whether you know much about the definition of anxiety, and I don't want to get into too much science or details, so I just love this one about this great little mouse. Sometimes we can really show a lot of anxiety, but it's actually a really healthy and normal emotion. We feel tension often in our body somewhere. We will have worried thoughts, and often there's some physical changes, as in our heart rate quickens, there's some flutters at times. Our body temperature often rises, as I notice mine is right now. And it's actually intended to prepare us to physically confront or flee from threats and towards safety. And part of the challenge that we have in our society now is there's a lot of bad news and difficulty out there, and it's triggering a lot of this fight, flight, or freeze, and it's not good for us to have this prolonged exposure. So that's one of the things I'm going to talk about today, is how to reduce that. And often with anxiety, it can last quite a long time, where it can be out of proportion to the initial trigger. But I love this quote by Mark Twain, who said, "I've known many troubles, but most of them never happened." So with that in mind, anxiety shows up in our bodies, in our minds, and in our actions. It often tends to lift our heart rate. Sometimes we perspire. Our breath rate often changes, quickens. Our voice changes. As you can notice, mine changes a little bit right now as I feel a little bit of anxiety too. Often people report things like little upsets in their stomach, little gurgles, and our thinking often changes too. We can get very distracted, a little restless, kind of antsy, and we ruminate or even irritated. That's often very common with anxiety. And sleeping patterns are often interfered with when it comes to anxiety. We just end up being often very sleepless. So how do we go about rerouting it? Or why? Because right now we have this very, very unique time that we're living in. And yes, in British Columbia, we have the good fortune of having Dr. Bonnie Henry guide us, and very low numbers with the COVID pandemic. But there's still a lot of difficulty. A number of us are feeling more isolated, and we have very limited family time, which is hard for any of us, and especially for those of you who are older and you want to have that time with family and friends. Also, our lifestyles are restricted and it's hard to adapt. So you might have been used to going to certain activities with certain people in your life, and now you've had to drastically adjust that. We all have. As well, issues of symptoms of COVID. It certainly sounds pretty severe and highly problematic for anyone. And so we worry, gee, am I getting warm? Do I have a fever? Gee, is this cough a problem? These aches, the actual symptoms are quite broad, so it's easy to wonder whether we have them. So those sorts of fears are natural. And then, of course, the really big one is the uncertainty about what lies ahead. A peer of mine, Dr. Dan Siegel, calls it VUCA times, where it's volatile, uncertain, ambiguous, and complex. Lots of changes going on all the time. So, and then there's sometimes confusion over our emotions. So just kind of letting you know that it's really natural, right, to feel these sorts of ways. And on that, we'll go to the next one. So I like to think of giving anxiety a detour. And because I'm one of 3 Ds, I've come up with the 5 Ts for this one. And the first one being turn toward truth. We are so good at filling our mind full of stories. We're really, really, really great storytellers. And then tuning into our bodies for safety, physical activity, breathing exercises, stretching exercises, all those sorts of things are really powerfully helpful with bringing down anxiety. And then, like I said last time, we want to really develop new habits, right? These paths in our brains are so full of habitual ruts that we want to train ourselves, and the best time to do that is when we're calm. And then we want to transform the discomfort into wisdom, because often there is actually great information that is within us that we're not accessing, and that we're thinking of anxiety as a problem, but actually anxiety comes up because it's helping us prepare to address a problem often. And then I always like to recommend that we tame it with playful creativity. So one of the things I really invite you very much is to really turn towards the truth. As Mark Twain said on this one, I love this, get the facts first, then you can distort them as you please. So the facts, I really enjoy working and listening and attending conferences with my peers, one of whom is Kelly McGonigal in Harvard. And she wrote a book called The Upside of Stress. And as she said in a great TED Talk some years ago, that there are many, many benefits to stress. And it's actually the way we look at stress that makes the difference. They did a really comprehensive study of cardiac patients, thousands of them actually, and they asked them, are you stressed? And then, how do you feel about stress? Is it bad for you? What's your attitude towards it? And they actually did long-term studies, and they found that those people who actually reported high levels of stress, but reported that they didn't think it was bad for them, they had the very best health outcomes. So it really matters how you look at it. Another thing about, a fact about stress is that, my son just went to the next slide for me. It's 2 secs. Oh, there we go, sorry. So when we have stress, we actually need a certain level of stress for our brain to pay attention. And without it, everything becomes pretty normal. We actually find that if we keep everything the way it is in our homes, we actually pay less attention. We don't even register it. So it's kind of like things go blank. But when we have changes and lots of activity and things that are new and different, our brains pay attention, so we learn better when stressed. I'm confused. Here we go. Oh, there we go. Okay. The work of one of my other peers, Bessel van de Kolk, is really fascinating. He did a lot of work on people who have PTSD and have gone through lots of trauma. But he found a lot of information about the general population as well. And one of the things that is very interesting is that our bodies store a lot of information. And so when we're going through something, we might not even know just in our minds that we might be nervous about something in particular. But when we come in contact with something, our body has a response to it. So you've heard about the condition of PTSD, post-traumatic stress disorder, where even just little things that happen when we're young. I had a client who saw her dog get viciously attacked by another dog. It was a German Shepherd. And for years, she would say that every time she got around a German Shepherd, she'd freak out or she'd yell at the person. And what we realized was she had some PTSD, because when people get exposed to certain things, only some of the information of the context gets memorized. So when we're in a stressful situation, if we react in a strong way, that's often because of this memory, and it's often in the body as opposed to the brain. And so that's when we always comment on being present. So we calm down, we take in the details of what's happening right now so that we can teach our brain, hey, that serious thing isn't so serious after all. And we'll do a few exercises around that in a little while. So like I said, anxiety is often a conflict between what's going on in your system and what's going on in your behavior. So when we're incongruent, when we're out of sync, when we're actually really, really wanting to be honest with someone about something we're not, if we're not being true to ourselves or a circumstance, often anxiety will get triggered. And another thing that I found really kind of interesting about our learning is that we know how we always talk about intuition or gut feel on something. And some people kind of blow off intuition, oh, it's not much, right? But we often get kind of a nervousness in our stomach or something will go on. And actually the part of our brains that store the wisdom and the learned experience over the years is called the basal ganglia. And the basal ganglia has nerve endings that come down into our bellies. So that's why we get this sort of intuitive feel in our gut. So sometimes it's actually worth trusting your gut. And then I really want to emphasize that, as I've already mentioned, so much of anxiety comes from the way we think of things versus the way things truly are. And David Burns in the US did a lot of research over many, many years on what they call cognitive behavior therapy, where he put together this pyramid of the situation at the top. And on one end would be your feelings, and another one are your thoughts. And so we might not be able to change the situation, but we can recognize how we're thinking about something and how it's making us feel. And then we can consider alternative thoughts. We can do things that shift the way our body feels. And then sometimes we can change the situation. So often, really, just recognizing these three factors is very, very helpful. And it really does change the way you can look at things and address anxiety. So as I said, the first T is about tuning into our bodies. And I love to think about giving anxiety a detour. And really, the problem with anxiety in our culture now is that our brains were evolved for survival, for way back when we were, out in the Sahara with the lions and tigers, and we really had to be on our toes. And yet, right now, we don't have that kind of anxiety, that kind of stress level. But we tend to, when we're in difficult situations, our bodies will give us signals and it triggers us to feel unsafe. And that's when anxiety really builds. So some wonderful ways to create safety again. Last time, if you listened to my last talk, I mentioned a bit about self-compassion. And self-compassion is really about recognizing that we're suffering in some way or they're struggling, and that we have some tenderness and gentleness for ourselves. And when we can exercise self-compassion, we actually cause our brains to calm down. We have three main functions of our brain. The first being safety, the second one being striving, and the third one being soothing. So when we exercise compassion for ourselves, when we recognize we feel anxious, it actually tends to shift our mindset to more positive versus negative. It's very closely linked to well-being, coping, motivation, and better health. So I'm going to invite us to do an exercise around self-compassion a little bit later. But the first part I'm going to invite us to focus on is our breath. We're often taught about breathing, right? And you've probably been to an exercise class, or maybe when you've been stressed, people will say, well, just breathe. Well, really, there's a lot of great studies and really beneficial exercises through diaphragmatic breathing. And if you were to put one hand on your upper chest and one just below your ribs and breathe, you want to notice the one on your lower ribs in your belly expanding, but not much in your chest as you breathe in and out. There are many studies published in a beautiful journal called Frontiers in Psychology. And this reported so many benefits. I'll share some of them with you. Reduced negative emotions, depression, anxiety, stress. Reduce cortisol, which is your stress hormone, which can be problematic if it stays in your body too long. Reduce blood pressure. Even enhanced pulmonary function, so your lungs. Improved cardiorespiratory fitness. And all of these sorts of things are things that are coming to our minds right now, especially given COVID is a respiratory illness. And other studies helped identify that it improves attention and sleep benefits. And I actually will report that just before COVID happened, I started to do a breathing practice in the morning and in the evening. And I have carried it on, and I have actually not slept as well as this in the last 4 or 5 years of my life. So I can tell you it makes a difference. But what I'm going to describe to you now are a few really, really simple breathing techniques that I'm going to invite you to practice at your leisure. And they'll really help, because when we notice anxiety, one of the best things to do is to go to the body to start calming it down first. And when we notice that the body calms down, then the thoughts will dissipate. So as I mentioned last time, when we're under a physical threat, our breath will always come in through our mouths. So simply choosing to breathe in through your nose teaches your brain, this is not a threat, I can calm down. And some of you might have a stuffed nose and it's a little problematic, but whenever you can, trying to breathe in through your nose really helps. And then out through our mouths. When we breathe out through our mouths and take longer breaths out, it slows our heart rate, engages the parasympathetic system, and calms us down. So simply breathing in your nose and out your mouth really, really calms you. And then another little tip is to actually pierce the lips so that there's a little bit more pressure and the breath is even slower going out. So to just kind of make a bit of a pucker when you're breathing out really helps as well. And then we've all been through experiences where we've had a bit of relief and we've kind of gone, oh, wow, like, oh, right? And actually saying the word, ah, reduces our anxiety level quite a bit. So if nothing else, just simply going, ah, I can see mine going, feel mine going down a little bit right now. Some kind of sigh. And you might notice once in a while that people hum. A lot of people hum when they're stressed, or they whistle, or they sing. And these, as I mentioned last time, cause a vibration in the facial area, and that actually really calms us down as well. So if nothing else, take a few breaths, purse your mouths, say a few ahs, hum a little, whistle a little, sing a little, and it will actually make a difference. And then, of course, some mindful movements, physical exercise. Most of us in Vancouver, so many of us are very active. So we're all very aware of the benefits. Exercising regularly can shift your mindset so dramatically. It calms the system. It actually trains our bodies to be more comfortable with moving quickly and having a high heart rate, and triggers serotonin. So we actually feel happier, more optimistic, more energized, more able. And when we're going through times like this, where we're limited, it's very empowering, and really brings us up and shifts us for quite a while. Other exercises that I would recommend are, especially when we're dealing with anxiety. Many people speak really quickly and they kind of speak really high in their voice when they have anxiety, and everything kind of ramps up. You can feel your heart racing and everything's going quickly. One exercise to do, which I'm going to back up and just show you a little bit, is actually if you put your feet together and then put your arms out to your side and slowly, slowly, slowly lift them. The slower, the better. All the way up. And the slower you lift them, the better, because what that does is it actually does what we call down regulates your nervous system. So that slows everything down. And if you do that several times a day, just in a little pause and a little break of your day, or if you just notice your heart rate going or your voice getting quicker, to just do it a few times, you'll notice a big difference. And then another little bit of information is that when animals are in the wild, if they've gone through a threat, when they finally get to a place of safety, what their body naturally does is it shakes. You've probably seen this with your own pet sometimes. They have this little vibration. You think, oh no, something bad's happening. No, that's actually helping release the cortisol out of their system. So if you can't do much else, you can literally shake. Let's shake for 5 minutes. Just shake it out. That's why dancing is so fabulous. And of course, another movement, which I talked about last time, is the power of a hug. If you have other people who you can get a hug with, then that's fabulous. And if not, you can at least recall a time when you were just having this beautiful warm hug, and just reminding yourself of that, feeling it, really brings a sense of calm into the system. So those are some tips. And as I said, really what we're looking to do is we're looking to use these tools. It's very, very hard. I'm sure many of you can relate that it's really hard to apply these sorts of things when you're in a stressful situation. So we need to identify times that when we are kind of relaxing at home, or maybe we're having a coffee with a friend, or we've just finished an exercise class, or you're going somewhere different, just to really practice these things when you're calm so that they become natural habits. Like I talked about last time, we have those natural habits that we always go to. So we want to build new natural habits. So I'm going to share with you a few other tools, and this is when I'm going to ask you to participate. So one of my colleagues, Rick Hanson in the States, has a few really beautiful books and writes a fabulous blog. And he talks about this concept of passing state to lasting trait. So we have an experience and we practice it over and over, remind ourselves, etc. And then it becomes a lasting trait in our brains and our bodies as well. It's just like anything new. It takes time and practice. So one of the things I'm really going to encourage you to do is, and I will actually make some sheets available to you, your residents at PARC, on feelings and needs. And it's really helpful to just be more aware and able to name how we feel. They've done a lot of wonderful studies on simply naming an emotion. That, hey, you know, you're going through this experience and something unexpected happens. They've changed something around where you're living and it causes some upset. And just to be able to say, well, you know, I'm frustrated right now, or I'm really bothered, or I'm feeling discouraged, right? Being able to name the actual emotion is very, very productive. And it also helps us recognize what we need or want at the time. I have some sheets that I can send over, and your residents can look them over so you can build your vocabulary, because in the studies that they've done, people who can name very precisely what the feeling is help the most when it comes to using this concept of name it to tame it. Another concept that my colleague Rick Hanson uses is what he calls the second dart. And the first dart is COVID. That we are, you know, dealing with this virus that is pretty lethal. And it certainly has some pretty difficult health consequences for many people. And it's then, of course, impacted our lifestyles, what we can do and we can't do, how we do it, etc. So that's the first dart. The first dart is the impact of this. The second one is the one we throw at ourselves for not handling things well, for, you know, being impatient, for being tired, for being sad, whichever. And that's a dart that we can withhold. Because when we really address something, or when we're in an experience and we have a certain natural emotion, the way that we respond to ourselves actually wires into our brain. There's a concept of a phrase we use called what fires together, wires together. So if you're feeling anxious and then you're feeling mad at yourself for feeling anxious, that's just going to build it up, right? Whereas what we want to do is we want to build in that concept of self-compassion so that we more naturally recognize, geez, I'm anxious. Okay, wow, maybe I need to just give myself a few minutes, take a few breaths, really just be kind. And on that note, I'm going to invite you to participate in a practice exercise. And this is one, a self-compassion exercise by a lovely woman named Kirsten Neff in the States, called Soften, Soothe, Allow. And this is aimed at helping you to introduce the concept of being kinder with yourself when you're struggling. And it can take some practice. So I just invite you to get comfortable wherever you are, wherever you're sitting, maybe you're standing, maybe you're lying down, you're just listening. And I just invite you to get comfortable wherever you are. And take a few breaths like I encouraged before, in through your nose and out through your mouth. And I'll do the same. And just allow yourself to just notice a few features of where you are. If you feel comfortable, close your eyes or maybe bring your gaze in a little closer. Notice the temperature of the room. Maybe notice a few sounds around you. Notice that you're taking some time just for yourself. And then I invite you, while you're taking these breaths in your nose and out your mouth, to put one hand or maybe both hands up on your chest. And feel the rise and fall of your chest as you breathe. Just really get present with yourself for a moment. In and the out breath. And then also, as you do this, notice your hands on your chest. Are you being here with yourself, for yourself? That's compassion. Having those nice breaths. And then I invite you, in the last few months, I'm sure you have felt some anxiety. And there might be a certain circumstance or a certain person, a certain event that really was difficult for you. So with your hands up on your chest, taking these deep breaths in your nose and out your mouth, bring a certain circumstance to mind that was a little bit bothersome, that was a little anxiety provoking. Just think about it a bit. Think about the people that were there, what was being said or done or not. Whatever it was that was bothering you, go ahead and notice that. You might notice a certain part of your body that it's kind of triggering. Maybe in your belly, maybe in your shoulders are getting tense. Whatever it is, just notice that part of your body and just be with it. And then I invite you to say to yourself, soften. Just soften. And then if you find a particular way that you touch yourself, maybe rubbing your hands together, maybe your arms face, your hands on your neck, in a way that soothes yourself, to say to yourself then, soothe. Just soothe. And then if you were to really kind of give something permission, you might open your arms a little wider. Just open yourself into a body stance of allow, just allowing. So soften, soothe, and allow. So if you're going to make some efforts to wire new pathways in your brain, having the firing of anxiety with soften, soothe, allow wired together is going to help you move and detour that anxiety. So I invite you to do that at your leisure at various times. Now I've also identified another one, which is RAIN, which stands for recognize. So recognize you've got something that's troubling you at the time, and just to explore it a bit and just allow it again to be. And then investigate or inquire about it a little bit. What's going on here? What haven't I addressed lately? What might this be telling me, right? And then recognize some of the needs that are coming up and what you might want, what you could do for yourself at the time. Those are the 4 tools I'm going to give you about this particular exercise, about anxiety right now. And then, like I said earlier, you know, there's actually quite a bit of knowledge that you carry. My goodness, I learned that your average age is 87. My parents are 87. And I know when I'm going through a rough time, I call my parents because they are very wise, as are you. And often anxiety comes up because there's this unsettledness. We're not actually paying attention to some things. And we can actually tune into ourselves a little bit more and tap it for some wisdom. So I invite you to really get curious here and wonder, you know, what insights or wisdom is really available to me that I just haven't touched in with right now, or I haven't been available to, right? And one of the questions I love to ask is, what's getting in the way of me enjoying my life just a little bit more? A friend asked me a few years ago, he said, Deb, you know, what would be one thing you could do less often or more often that would give you a greater sense of peace or ease? Or even, what do I really want right now? What do I need? So when anxiety comes up, to ask yourself those questions helps you uncover some insights and some wisdom. Another element of anxiety is when we are struggling sometimes, we put ourselves aside, we appease, we go along, we compromise, right? And often anxiety is trying to shake you up to say, hey, I matter, right? Speak up, do something that's helpful for you. So I just invite you to ask yourself once in a while, hey, am I weighing in enough for myself here right now? Maybe that's why the anxiety is stirring up in me. Another one is assertiveness. And sometimes people confuse being assertive with being aggressive. And actually being assertive is just being clear and honest and sometimes a bit bold about how you feel about something or what's going on. A typical script with being assertive is when such and such happens, I feel, or gee, it bothers me or whatever, and I need, or I would appreciate it if you did this? And then the person might reply, and you repeat how you feel they've responded, sharing back to them that you hear them and understand them. And if you feel that it's not going through, you just repeat the same message. And that really helps you get your needs met and take better care of yourself. And it really does, they've done lots of studies on it. The assertion is an amazing, exercising assertiveness regularly, it creates a far less anxiety. Another big one is boundaries. What we call boundaries are basically if something's okay for you or not okay for you. And right now with COVID, we've got lots and lots of different things that we have to do and not do. And everyone feels quite differently about it all. And that's fair because we're all unique. But we all do have the right to say, hey, you might have that choice, but that's not my choice. So let's either have a discussion about it or we just kind of lay down the laws, right? So expressing boundaries is very, very powerful, and it can be a very helpful tool in reducing anxiety. There's actually a really great talk by Braun about boundaries that I would highly encourage you to go to pay attention to. We're just going to the next slide. Oops. So, of course, what I always love to talk about is having some fun. And sorry, I'm not sure. There we go. Just, of course, it's hard to have fun when I'm standing in a room without the audience in front of me. My son's queuing it up for me. But I always think of anxiety as one of those things where we got to play with it a bit. And we get to tame it with being playful and being creative. And what I always, oh my goodness, I can't get the cues right. Here we go. I love this one little image of this gal, able to jump to the wildest, biggest conclusions in a single leap. And anxiety is really, really a powerful emotion. But when we can actually have some fun and have some humor, I'm sure we've all been through many experiences. I know I have, where, after some time, after a pretty embarrassing or difficult experience, we've been able to have a really good belly laugh at ourselves over it. And humor is enormously helpful. It helps us feel more connected with people, gives us a broader perspective, and it really normalizes and calms our emotions. And I just really encourage you to consider, sometimes when things are really tough, there are a lot of really great jokes, whether it's on something on YouTube or some funny shows. And humor is just a wonderful outlet. Actually, just even smiling, just the act of smiling stimulates feel-good endorphins. So smiling in itself is really powerful. And then last but not least, creative expression. When we're actually creating artwork, maybe we can't change a situation, but we can be expressive. And when we are being expressive in any kind of creating any kind of art, we actually feel energized. When we're in a situation where there's very little that we can do, and we make some kind of artwork where we're either writing or doing painting or drawing, singing, creating events together, etc., it actually makes us feel very empowered. It triggers a lot of really great neurochemicals that calm us down and makes us feel quite enlightened. And it actually helps us feel a lot healthier as well. I know years ago when I was living in a community in New York, I had already had a diagnosis with diabetes when I was pregnant, but it had gone away after my pregnancy. And one of the things that I decided to do was join an art studio. And at this art studio, there was quite a broad cross-section of people who would go there regularly. It was like a big communal studio, and people would pay a fee and they could use the tools and equipment. And one day, a few of us were saying just how fabulous we felt when we were there. It was just so great, and how we'd go home and a lot more optimistic. And an older gentleman looked up and he said, well, you know what else is great is I have diabetes and my blood sugar is way better when I'm doing my artwork. And little did I know that that would be a great tip for me years later. And so when you think about it, COVID is a bit of an intense condition right now. It's lingering around, but when we can actually make art and it improves our health, that's a really powerful thing. So I hope that you will at least dabble, at least to some degree. And it also energizes us. And another really powerful thing about being creative is it shuts off the prefrontal cortex, which also takes with it the self-critic. So we tend to be far less critical when we're being creative. The state of flow has been documented and researched, and it calms us down and makes us feel better about ourselves. And that's always a good thing. So I am coming to a close on this part of the experience today. And I just want to remind you that there are so many wonderful tools that you can use for anxiety. It is a very powerful emotion. It can flood us very quickly. It can cause us to freeze. It can cause us to really lash out. It can really rob us of sleep and trigger us a lot of different ways. And, stress and anxiety is not a bad thing unless it carries on and it keeps moving and staying in our nervous system and our health for a long time. Cortisol and adrenaline get triggered when we're stressed, and having that in our system for a long time is not good for us. But the tools that I've shared with you today to really help you reroute anxiety to that state of I am safe will hopefully move you to feel less anxious, and then have some tools that will guide you towards turning towards truth, catching yourself in the stories, and recognizing, hey, there's actually, the way I look at this can really change. And well, there might be some research about this, but the research about COVID isn't necessarily just about me. It might be about others as well. Choosing to tune into your body for safety with breathing, with noticing when you can just do simple exercises that will calm you down. And exercise itself, physical exercise, is so powerful for relieving stress. And then, as I said earlier, what wires together, fires together, wires together. So training yourself when you're calm to practice these things, to build these tools and build these habits into your brain is very, very helpful, so that when you are undergoing something that's very stressful, that you'll have these tools available. They'll be just part of how you're wired, so to speak. And then I really, really hope, like I said, you're at a beautiful ages in your lives, and I know that your lives are pretty robust and dynamic still. And you have a lot of wisdom in you. And I hope that you will tap into the discomforts of anxiety for whatever wisdom they can provide you. And then at the very least, if nothing else, that you have some playfulness and fun with the anxiety. One of my favorite tools is to use this one where you describe what's happening for your life as yourself. You're an observer of what you're up to, and you're describing it as though you're narrating. Oh, look, there goes Deb again. There, she's worried about whether her kids are going to be safe while they're camping this weekend. Oh my goodness, look at her go. Wow, she's been thinking about this for hours. I wonder how long it's going to take her to change tracks on this one. So we get the narrator going and have a little fun with it. And I hope that you will apply some of these tools to reroute your anxiety. Because, like I said, one of my colleagues, Carla McLaren, wrote a book recently about embracing anxiety. And I just want to emphasize that emotions are not the problem. They are actually here to help us with the problem. And I hope that today you've got some tools that will help you feel encouraged, a little bit more courageous to try something new. And that as you do, you might notice that when you change the way you look at things, the things you look at change for the better. Thank you very much. And I'm open to some questions.
Thank you, Deb. That was fantastic. I think I already know what my next Halloween costume is going to be. I think I'm going to go as anxiety girl and give everyone a good laugh.
Well, and there will be many different costumes for anxiety girls, right? Because everybody's anxiety shows up differently. You know, someone might come in flaming red because they're just so on fire, their body overheats so much.
Absolutely.
Other people will come by as the big devil because they just really, really get kind of ferocious, right?
Yeah. No, I think humor definitely plays a part to relieve some anxiety. So I think that rings very true for a lot of folks. I know a lot of our teams have a lot of great fun and what they plan for activities and getting the art club going and painting and things like that. So I, as you were speaking, I was really thinking about all of the things that our teams do to keep our residents engaged and try and promote those positive releases. So it's really nice to hear you talk about those things.
Mm-hmm, mm-hmm.
So any of our active living managers or those that are running the sessions at the sites, feel free to either type in the Q&A or unmute yourself if you do have a question that you would like to pass on.
I don't bite. Well, you know what you could do while you're wondering is just take a few nice breaths. Practice breathing in your noses and out through your mouths. Or maybe you could start whistling a fun little tune and everybody could whistle along. And as I said last time, I'm more than happy to answer some questions that you might have that might get sent through from some of the active living team or through Jacqueline and Louisa. Very, very happy to answer some questions at a later date. No problem at all. Oh, maybe you're all so calm, you're just so relaxed.
One of Mulberry's residents would like to know your take on Stanford University chronic pain courses.
Oh, they have great ones. Okay, so that's the Healthy Living with Chronic Conditions program, probably. That is Katie Lurig's work from years ago. I actually used to be a volunteer, a co-facilitator with that program. It's excellent. They offer it through University of Victoria here, I think, now. And it's a 6-week program. You meet for 2 hours a week, 2 or 2.5 hours. You get together with a group of people who have similar challenges. And they have one for pain, one for arthritis, one for diabetes, one for other various conditions. And what's great about it is you meet a lot of other people who are in a similar situation. You learn some wonderful tools, similar to some of the things I shared with you, and lots of different exercises, communication skills. But you get, and they have a great system where each week you're encouraged to set some goals, or at least a goal for the next week. And they really are great at encouraging you to set goals that you can achieve. And they're very, very supportive. The facilitators typically, there's usually 2 at one time, they typically also have the condition that you would have, so they can relate to your circumstance. It's a very, very good program. I'd highly recommend it. And what's lovely is they offer it all over the place. So you might be living in New Westminster and there would be one at a community center, or I would imagine right now they're probably offering it all online. But you will be connected with other people who are struggling with similar condition. And it's really excellent program. Yeah, I think it's called Healthy Living with Chronic Conditions.
That's great. I'll try and find some more information and I will send it out to the sites. That's a good resource to have.
Yeah, it's really good. If I can, I'll dig around for my contact with it too.
Sure, that'd be great.
Karen,
yeah,
it's really
wonderful.
Excellent.
We're getting a lot of thank you for the presentation. They really enjoyed it. Those messages are coming in now.
I'm glad.
Good. Any further questions from anyone, any of the attendees? Feel free to use the Q&A box.
My techie's moving some of my tech stuff. It's kind of fascinating.
Okay. Okay, if there's nothing else, we will be coming back next week with Dale Trimble with Making Friends with Anger.
And
which
Dale
should be
is a great
fabulous
speaker. Yeah, Dale gives really great workshops. He does a lot of training, and he's worked with a broad range of people around anger, and he's so terrific with it. You'll really enjoy it. And as I said earlier, all of us who are the counselors with delivering the series are happy to answer any questions you might have. If you want to send things in later on, it's absolutely fine with us. And I would just want to say I won't be doing another one, so I'm just really grateful for this opportunity, and I really wish you all the best, and I hope you have some fun, giving anxiety a detour. Take care.
Thank you, Deb. Have a wonderful day, everybody. Bye-bye.
You bet. Bye-bye.